Why do we need a pediatric dental branch?
Individual teeth in a child is different. Every treatment which we provide for a child is different, and the approach which is required to handle a kid is very, very different.
How do you treat that child? How do you plan for that patient?
In pediatric dentistry, we have this concept of pediatric treatment triangle. Nighttime brushing itself is considered such a थिंग, अरे यार ये तो हमको मालूम ही नहीं था कि राइट टाइम ब्रशिंग करना चाहिए. किसी भी पैरेंट को आप ये पूछ के देखो कि आपका बच्चा बेड में एक जगह पे सोता है क्या. बच्चे रोएंगे तो बाहर जो 4 पेशेंट बैठे हैं वो भाग जाएंगे. इट इज़ नॉट द वन. Give some time, give your patience, give your understanding for the child.
It's really an honor to have you. The plethora of experience you bring is really amazing. Good evening, everyone. I am Dr. Keval Shah. On behalf of Fine Feather Dental Academy, I welcome you all, and also my esteemed guest, Dr. Ganesh. Welcome here.
Hello.
And so, before we start, I would like to introduce all of you to Dr. Ganesh. Dr. Ganesh is one of the most senior pediatric dental practitioner in Ahmedabad. He has completed his MDS in Pediatric Dentistry from Manipal Academy of Higher Education under the able guidance of Dr. Shobha Tandon, a stalwart who is renowned across India. So, Dr. Ganesh is actively involved in academic teaching and has trained many undergraduate and postgraduate students. You have the number count?
Almost maybe more than 60.
More than 60 PG students have honed their skills in pediatric dentistry under him. He has multiple national and international papers presented across various conferences and more than 15 publications in index journal across India. He is a life member of Indian Society of Pediatric and Preventive Dentistry and has been an active member in organizing, conducting various national level conferences across India. In the end, he is a successful pediatric and general dental practitioner since last 18 years, and it's really an honor to have you. The plethora of experience you bring is really amazing. Welcome to the podcast, Dr. Ganesh.
Thank you so much for this honor, Dr. Keval.
So, Dr. Ganesh, let me start with the most basic question. Why do we need a pediatric dental branch? Why it's all the same thing which has to be done in normal patients? So, why a separate branch for pediatric dentistry?
Actually, it's a very good question because this is something which a lot of parents do ask me when they come with their kids. Now, all of us understand that children are not just miniature adults. Especially in today's world where everybody is having just 1 or 2 kids, the whole focus of the family is the kid. And can you imagine today taking your child for his or her physical or any other medical issues, going to a general practitioner? No, all of us go to the pediatrician. Similarly, the need for the dental problems for children is separate in case of kids, and it is the pediatric dentists who are specialized to understand those problems and tackle the children at their level, providing the best of treatment which is required for a child.
So, to summarize, what you are saying is that not only the teeth inside a child are different, their needs are also different, the way to handle them is also different.
Exactly.
And that's why you need special training.
Yeah, because the problems on the outset might look the same, but it is just not the same. Every individual teeth in a child is different. Every treatment which we provide for a child is different, and the approach which is required to handle a kid is very, very different. And it is not just handling the kid, it is the handling the parents also, making them understand the requirements of the child is also very different. So it needs a specialized branch to take care of these problems in case of children. That's why there is a specialized branch called pediatric dentistry.
Wonderful. So, Dr. Ganesh, you aptly said that there is a special need for pediatric dentistry. But how do we communicate this to the parents? How do we tell them that what they are supposed to do and what should, according to, is the ideal time that they should bring their children or child for a checkup to a pediatric dental surgeon?
See, Keval, being a dentist, you yourself are aware that normally हम इंडिया में ये देखते हैं कि ज़्यादातर people come to us only when the pain is intolerable. And similarly in case of kids also, it so happens that जब बच्चों में बहुत प्रॉब्लम होती है, बच्चा खाना नहीं खाता, रात को सोने में तकलीफ होती है, और the kid is really having a huge swelling, that is when normally the parents approach the dentist. Unfortunate situation it is, but as an pediatric dentist, I would advise parents that the moment couple of teeth have come into the oral cavity, that is when they need to approach the dentist, whether it is a pediatric dentist or any dentist for that matter. Say for example, for a child, every now and then we are going to the pediatrician to get their vaccinations done, for a general checkup and everything. Similarly, if they come at the very early stage, the dentist or the pediatric dentist will be in a better position to make them understand at various time intervals when these milk teeth are going to come, how to take care of them, whether they need to brush or the teeth or not. If they have to brush, what kind of a toothpaste to be used, what is the method, or how simply or easily brushing is possible. So these kind of advices can be given by the pediatrician. It's not just about treating.
Yes, that is what I was about to say. When you bring your child, when he or she needs a treatment, then there is an association of pain or fear which comes into a dental visit. I believe what you are saying is that if you bring your child when he or she doesn't have any symptoms, they'll be better acclimatized to
visit. Let this become a habit for the child, that coming to the dentist, it's not that, say when there is a problem and they are coming to the dentist, obviously the treatment is going to be an invasive treatment, and that is where the fear is getting instilled in the child. So if the child is becoming used to coming to a dentist just for a normal checkup and getting his teeth checked, so it becomes important for the child also to understand that these teeth are also important for me, and the parents are also in a better position to make it understandable for the child, right? So the moment new teeth have come, it should be a mandatory thing that they should visit the dentist and understand, and also make the child acclimatized to the clinical situation, so that later on some situation, if at all it arises, they are in a better position to be handled by the dentist as well as for the parents to take care of the child.
That makes sense. That makes a lot of sense. You said that the children have separate set of teeth and adults have a separate set of teeth. During your introduction, you highlighted why pediatric dentistry is needed. So that brings a question to everyone's mind, not the dental surgeons, but the patients, the people, the parents and everyone, that if the dental set of teeth, the milk teeth, they are going to be lost, exfoliated, and are going to be replaced by permanent teeth, then why should we worry about keeping them, treating them and saving them? So can you just elaborate so for everyone's benefit?
This is a common question which parents come with, and I understand it from the parents' perspective, because when they see that, yes, the more than that, the fear is how is the child going to handle at any kind of a treatment, because many times it has so happened that the parents have on their own have had some bad experience as far as the dental treatment is concerned, and they directly relate कि मेरा बच्चा ये कैसे करवा पाएगा, and that is why this idea comes कि milk teeth है तो let it fall, or let us just remove it rather than going for any kind of taking the easy way out. Now केवल आप मुझे एक बात बताइए, अपने बॉडी में कोई एक ऐसा पार्ट है क्या जो अपने काम का नहीं है और भगवान ने हमको दिया है? नहीं. If you lose your little finger, you will be a disabled person for life. Absolutely. There will be some kind of a handicap, some difficulty. Absolutely. Definitely. Even नाखून काटते समय थोड़ा सा 1 सेंटीमीटर एक्स्ट्रा कट जाए तो पूरे दिन अपने को वहाँ पे पेन रहता है. तो just imagine a complete 20 set of teeth which God is giving you at the age of 6 months when it is coming, and it is going to remain in the mouth till 12-13 years of age, and these are the very important formative years of the child, where the child is growing from a 2-year-old to 12-year-old, 14-year-old when he is entering into his teenage life. So this important growth phase, the teeth are the ones which are going to form his face. It is going to help him in proper chewing, which is going to help in the jaw development. Anybody who has not had, you must be definitely aware, being a prosthodontist, the people who are not having their teeth, the jaw development itself is affected. So can you just imagine a tooth being removed? So obviously we are going to affect the jaw development of the child. speech is definitely one of the things which teeth are important. And in today's camera conscious world, just imagine a child not having his front teeth, and every now and then somebody's taking a selfie, and just
The
imagine the
psychological trauma, yeah.
psychology or the confidence which the child is going to lose. So from any angle if you look, the milk teeth is something which is very very important. And more importantly, रातों रात सारे मिल्क टीथ चले गए और परमानेंट टीथ आ गए, ऐसा होता है क्या? नहीं होता है, राइट? It from 6 years when the permanent teeth starts coming, every single milk teeth is making way for the more important permanent teeth to come into the arch.
Right.
And the permanent teeth which are coming, those are of bigger size, and they are going to fit into the smaller one. Just imagine the beauty of nature. So the milk teeth are acting as a space maintainer for the permanent teeth to come into this space and establish the right kind of occlusion which is going to remain for life.
This is so wonderful, so amazing. You just think about how nature has made a human machine. I call it
It's a
human
machine. It's a
right?
machine. True.
So the small teeth, they look good on the cheruby face or chubby face of the child, and they function and provide impetus for growth of the jaws, and then the bigger jaws can house the bigger teeth. So just see the sequence, that how can someone feel that they are not important?
Yes,
I can
obviously.
understand.
It's just a lack of knowledge or understanding on the parents' part, or anybody for that matter who is guiding them in that direction, that these are not important. They are obviously very very important and need to be given the same kind of care and attention which any other individual needs to be given,
Any other organ.
and any other organ for that matter.
So, Dr. Ganesh, if I may ask you, you have treated so many children in your various posts in the colleges, as well as right now currently in your private practice. So what is the most common problem that you see the parents bring their child with to a dental clinic?
The most common problem with which the parents come is kids suffering with multiple cavities in the mouth. From a textbook point of view, this was commonly called as a rampant caries, but more aptly as a practitioner or somebody who is teaching my postgraduate students, we call it, or we have given it the name, early childhood caries, which is present in the milk teeth. And though it is getting established at a very early young age, this is something which is going to impact for a life for the child, because these are the type of cavities which occur in the child, involving almost all the milk teeth except for the maybe the lower anteriors which get covered with the tongue, and that's why they get protected. Primarily, this was initially, it was believed that this is occurring because of faulty feeding habits, and though it is an important mechanism because of which the children suffer from this, but with the changing times, what I have been saying is the kind of food habits which most of these kids are exposed to, lots and lots of junk food. When आप और मैं जब छोटे थे, हमको शायद फ्रूटी महीने में या 2 महीने में एक बार मिलती थी. आजकल हर बच्चे के पास ऑलमोस्ट एवरी सिंगल डे दिस इज़ अ डे टू डे अफेयर. हर वीकेंड्स पे बर्थडे पार्टीज़ हैं, या नहीं है तो घर पे पेरेंट्स मंगा के देते हैं. एंड आप देखोगे पेरेंट्स विल वेरी इजीली टेल, डॉक्टर साहब आप उसको बताइए कि चॉकलेट्स नहीं खाने. अब चॉकलेट बच्चा तो खुद ला के नहीं रख रहा है घर पे. Parents are themselves keeping it in the fridge, and the child is obviously going to take it. So the exposure to so many sticky kind of food which are so dangerous for the teeth is something which is affecting the kids.
So the dietary choices which the parents make for their child are primarily, you suggest, responsible for this
Just
early
like
childhood.
just like how diabetes and hypertension has become a lifestyle kind of a disease, similarly a lifestyle disease for the child is this exposure to these kind of foods which the parents are making the choice for them, and the child is suffering at their cost. And obviously the one thing which I have seen in last few years is this is something which I believe is one of the common reasons apart from this exposure is most of the kids, or almost at every home, the children are used to having their food with the help of mobile phones or watching TV, and the mother is feeding the child. So food habit which has to be say for 15-20 minutes each and every session of food, whether it is lunch or dinner or anything for that matter, is continuing for 45 minutes to 1 hour or 1.5 hours sometimes.
Very important
And
observation.
when the food is remaining inside the mouth, obviously it is going to cause the cavities.
So the Acidic.
And the acidic process is continuing in the mouth for a long
longer
period of time, and this is happening every single day. So this is where the child is suffering. So
They are more susceptible to developing cavities.
yeah. So
Wonderful.
this is the most common problem which I see, which most of these kids are nowadays exposed, and it is very rampant, very very rampant. Not just in case of cities like Ahmedabad or any other metro cities. Even when we used to conduct camps through colleges in rural areas, there
Even in
also the
rural,
same.
so there is no urban.
There is
rural
no
divide
urban
over
and rural divide. Everywhere the problem remains to be the same.
So, doctor, when a patient like this with multiple cavities comes to a clinic or visits you, what is your approach towards this? Like, how do you, not just the procedural thing, as a complete person, how do you treat that child? How do you plan for that patient?
In pediatric dentistry, we have this concept of pediatric treatment triangle. Now, this was a concept which was introduced almost 100 years back, but basically it says that when you are treating the kids, especially in pediatric dentistry, it is a combined effort of the child dentist as well as the parent who have this primary idea of treating the child. So any pediatric dentist or any practitioner who wants to take up treating kids, the approach has to be where the parents as well as the dentist are on the same page as far as the understanding the needs of the child is concerned. So the first and foremost thing would be to educate the parents,
Counseling
the parents, making them aware of the harmful habits which unknowingly they have introduced, thinking that they are doing good for the child, like the diet habits which we already spoke about, or even the brushing. You would be amazed, Keval. Also, you must have seen कि nighttime brushing itself is considered such a thing. अरे यार ये तो हमको मालूम ही नहीं था कि nighttime brushing करना चाहिए. Whereas
Very
all of us
good.
understand that nighttime brushing is so very important.
More important.
It's more important than the early morning
Daytime
brushing, right? So these kind of things where we have to make the parents understand what are the set of things which they need to do at home, whether it is the diet modifications, whether it is the brushing habits, whether it is the eating habits which they are introduced, right kind of food which they need to bring for the child. And not just that, पेरेंट्स कई बार बोलते हैं कि डॉक्टर साहब आप उसको बोलो कि आपके पास ये बात नहीं मानेगा तो आप इंजेक्शन लगा दोगे. अब बच्चे को आप घर पे बोल के डरा रहे हो कि इंजेक्शन लगा देंगे, और यहाँ आके आप एक्सपेक्ट करोगे कि डॉक्टर कोई मैजिक करेगा क्या? इट्स नॉट मैजिक, राइट? सो वी हैव टू टेक केयर ऑफ द चाइल्ड. सो इस टाइप का डर, या द कंडीशनिंग हैज़ टू स्टार्ट एट होम. इस तरीके के डरा से ये तो काम होने वाला है नहीं. तो सो ऑल दीज थिंग्स नीड टू बी डन.
कहते हैं ना कि सो जा वरना गब्बर आ जाएगा.
हाँ,
तो हम गब्बर
बन जाए और घर वाले हमेशा सही रहे, ऐसा थोड़ी चलता है, राइट? तो ये, सो द फर्स्ट थिंग इज टू एजुकेट द पेरेंट्स and then make them understand and participate in the treatment planning. And then subsequently the various approaches for treatment is obviously there, whether it is taking care of the dental problems which are presently there, and more importantly the preventive aspect of the problem, that is the teeth which are tomorrow going to come for the child, is more important. And that is where the parents understanding of the whole situation is important. And I would say the follow up over a period of time, because एक बार प्रॉब्लम खत्म होने के बाद कोई वापस फिर से नहीं आता. एंड वी आर ऑब्वियसली नॉट डूइंग एनी मैजिक दैट टुडे एवरीथिंग हैज बीन सॉल्व्ड एंड टुमारो एवरीथिंग इज गोइंग टू बी ओके. नो, इट्स नॉट लाइक दैट,
राइट?
सो regular follow-ups,
Whether
when
to
they
check whether they have made the
changes
suggested
have
or-
been done or not, whether it is the habit has been broken or not, all these things matter. And when the follow-ups is being done, we are able to see the right kind of changes which are required in the child, and that is how the child becomes an more responsible dental patient over a period of time.
So you have divided into 3 phases if I summarize. First is counseling
And
parents,
educating the parents,
right?
Yeah.
Second is procedural treatment,
Whatever the kind of treatment
whatever
which we are
decided.
going to provide.
Third is follow up and checking on a regular basis that the issue is permanently taken care of. Otherwise, they'll come with the same problem a year down the line.
And I would say, Keval, in these 3 steps which we are talking about, most of the general practitioners or most of the young students who are starting their practice, they are only focusing on providing the treatment to
The
the
second
children,
part.
second part, not taking care of the first part, that is the educating the parents. Neither they are interested in the follow-ups. But these are the two things which are more important, and that is going to determine how your treatment is going to be successful.
Accepted, and that is going to determine whether he becomes a patient for life or not. Otherwise, you just do the second part, you don't take care of the first or the third phase. Year down the line, they develop the same problems, they visit some other dentist and think that
And the cycle continues.
yeah. So I can understand what you're suggesting. So if you want more patients coming to you, if you want the entire family sticking to you, then you have to treat them the right
And pediatric patients are the best ones who are your brand ambassadors
for
your
life.
practice. Yeah.
Now they've got more of a life,
Yeah.
unlike their grandparents.
True.
So wonderful. So Dr. Ganesh, this last question was for the parents and the child who need treatment. So I want to pose one more question to you, keeping in mind the benefit that or the insight that it can provide to our beginners, freshers, graduates. So what according to you is the most important phase of dentition, and how do we communicate that to the parents?
Yeah, so far we understood the importance of the milk teeth, but as far as the dentition development is concerned, according to me, or even you would agree, the mixed dentition phase, where both the primary teeth as well as the permanent teeth are present, and the definite change which is taking place in the oral cavity, where the milk teeth are making way for the permanent teeth, and the right kind of occlusion is being established for the child. That is the most important phase of in the development of dentition.
Mixed dentition phase.
Mixed dentition phase.
From 6 years to
From 6 years to 12 years
12
it continues, where from the first transition and the second transition, things are taking place. When the anteriors are coming in the first phase, and then there is a dormant phase, and later on when the premolars and canines get established.
Fine. So, what special precaution would you suggest your students or maybe your practitioners who just started their pediatric dental practice? What they can suggest? How they can highlight the importance of this phase to their prospective patients or to the parents?
So the growth which has to take place in the right direction is very, very important at this phase, because till this time, when the permanent teeth have started coming, the child has not had the jaw growth which is completely required to accommodate all the permanent teeth. So if the direction is in the right direction, then the establishment of the permanent occlusion becomes very comfortable, smooth and perfect. And if things are not in the right direction, then the intervening problems like development of new malocclusions and others can take place at this phase.
The doctor has to advise the parents about breaking the habits if they see any habits in this phase, and getting regular
follow-ups at this
evaluation.
phase is very, very important, so that they understand that these milk teeth, when they are falling, and the permanent teeth, they are coming in the right place. Initially, many times it so happens that the permanent teeth are coming out of the arch also, but it is just a matter of time which we have to give and wait and watch for the permanent teeth to get into the right direction and
As the
into the
jaw
right
grows,
place
they will
as the
accommodate.
jaw grows. So monitoring at this phase is very, very important. That's why the mixed dentition phase becomes a very, very important phase, where right kind of follow-ups are being.
And if we take right steps at the right time, we might avoid costly braces treatment later on, right?
Definitely, it is something which is very, very mandatory, and by taking the right follow-ups and the right direction at this phase, getting the right occlusion will be very easy for the patients. Whether they will be completely avoiding braces or not, that is something which can be determined at a later phase.
Wonderful. So this is what I wanted, that the dentistry as such is right now more focused on procedures, right? So I think what you are suggesting is how to be preventive in your approach and
The right
minimize the
preventive
procedures.
approach is required for, so that more severe treatments may not be required for the patients.
Wonderful. So as I asked just now, as a dental surgeon, I need to evaluate the child, whether the child has got proper set of teeth, whether he has got the right shedding pattern of the teeth, whether he has got any habits uh, which might affect the growth and development of the jaws. So as a parent, if someone has to know about this, how do you communicate to the child's parents what they should look about the habits, which habits are harmful, how to make them avoid it? Can you just shed some light on that?
See, as far as habits are concerned, uh, whatever habits which are present in children, which is involving the mouth, like thumb sucking habit, or lip biting, or nail biting, or something like tongue thrusting, or even grinding of teeth at the night time, and even mouth breathing. These are the habits which are present commonly in the developing age of these children, this kind of children, and presence of these kind of habits severely affects the dentition as well as the occlusion. And one of the most important habit the which is causing the most problems,
Most commonly
encountered problem, is mouth breathing habit.
Okay.
Earlier, when we were postgraduates, Keval, that time most of the focus was on thumb sucking habit, or even bruxism or night grinding, which I was talking. But mouth breathing is something which is of
More
prevalent nowadays in
Why?
new kids.
Why? Can you just tell us something about it? Why? It's
देखो केवल
so-
अहमदाबाद की बात कर लेते हैं हम. अहमदाबाद में आप देखो, पोल्यूशन इतना ज़्यादा है. विंटर में हो या कोई भी टाइम में हो, हम घर के अंदर एसी लगाते हैं, टीवी, ऑफिस में एसी है, गाड़ी के अंदर एसी है, तो आउटडोर एक्सपोजर किसी को भी नहीं है. कोविड के बाद तो सिचुएशन इतना बुरा हो गया है कि बच्चे आजकल बाहर खेलने के लिए नहीं जाते, मोबाइल फ़ोन पे बैठ के क्रिकेट मैच, फुटबॉल मैच खेल लेते हैं. मेरा बेटा चैम्पियन है उसमें, बट नीचे 2 स्टेप्स नीचे उतर के नहीं जा पाते, राइट. सो द एक्सपोजर विच इज़ नॉट देयर टू द आउटसाइड एनवायरनमेंट. विटामिन डी डेफिशिएंसी इन अहमदाबाद की 45 डिग्री टेम्परेचर पे हर एक को है, राइट. सब सप्लीमेंट्स लेके चला रहे हैं. तो व्हेन नेचुरल एक्सपोजर इज नॉट, लाइफस्टाइल इज सो बैडली चेंज दैट थोड़ा सा भी आप देखो, हर बच्चे को देखो, हर एक सीजन में कोई ना कोई बीमारी चल रही है, सर्दी खांसी चलता ही रहता है. एवरी नाउ एंड देन द नेजल पैसेज इज ब्लॉक्ड, and because of this frequent exposure to allergy or other these kind of problems, every child has become a habitual mouth breather. And because of this constant mouth breathing, even if the nasal passage is clear, the child has become so used to this, the facial changes have so badly come that the child is always a mouth breather. And see, nose is for breathing. मुंह से हमको खाना खाना है, पानी पीना है, बट सांस लेने के लिए नहीं है. आप और मैं यदि 100 मीटर का रेस लगाएंगे तो हाँ, जब सांस फूल जाएगी तो वी विल ब्रीथ फ्रॉम द माउथ, बट हमेशा मुंह खोल के ब्रीदिंग करना इज नॉट द राइट थिंग.
that is a sign that the
oxygen which is required for the child is not to be sufficient. And mouth breathing is something which is of devastating consequences. Not only from the dental point of view, it affects the psychological development of the child, and multiple kids who are wrongly diagnosed for autism and ADHD are ones who are suffering from mouth breathing habit. So establishing the presence of mouth breathing in case of children, obviously pediatricians are someone who will be, but pediatricians are so overburdened with other problems that they hardly look into these problems. ENT के पास ये सब प्रॉब्लम्स के लिए कभी कभी हम जाते हैं, कभी कभी पेरेंट्स नहीं जाते, पर डेंटिस्ट के पास यदि आते हैं, बाय सिंपल एग्जामिनेशन ऑफ द ओरल कैविटी, टॉन्सिल्स, the shape of the palate, any dentist can very easily establish whether the child is a mouth breather. आप मानोगे नहीं, केवल किसी भी पेरेंट को आप ये पूछ के देखो कि आपका बच्चा बेड में एक जगह पे सोता है क्या. यदि वो बोलते हैं कि नहीं, एक जगह पे नहीं सोता और पूरे रात यहाँ से वहाँ होता है, दैट मीन्स द चाइल्ड इज़ नॉट नॉर्मल. पहले हम ये मानते थे कि बच्चा बहुत थक गया है तो यहाँ से वहाँ होता होगा, बट इट इज़ नॉट. जस्ट लाइक हाउ वी एडल्ट हमको पीसफुली सोना चाहिए, उसी तरीके से द चाइल्ड नीड्स टू बी स्टिल.
Exposure of the blue rays, the exposure to television, as you said, mobile, that could be one of the reason.
Yeah, and even a child who is having mouth breathing, he will every now and then he will change the head position and he will not be able to breathe from
comfortable position.
Yeah.
So this observations that you have made and what you have talked about just now, I believe how can you help the newer batch of dental surgeons passing out, the new practitioners? How can they analyze this, understand this, and convey all this to the? Can you just give them something of a capsule which they can easily ingest and?
See, young pass out students who are practicing or who are aspiring to establish their practice, I would say that the previously what people used to think that you avoid kids in your dental practice because बच्चे रोएंगे तो बाहर जो 4 पेशेंट बैठे वो भाग जाएंगे. It is not the one. Give some time, give your patience, give your understanding for the child. Once the child is becoming your patient or you are able to provide a right satisfied treatment for the child, you will develop the trust of the parents, you will develop the trust of the grandparents, and once for all the whole family will become your.
So they are wonderful practice builders rather than the other
excellent
way
practice builders. And kids, आप मानोगे नहीं, बच्चे अपने खेल कूद के टाइम में डिस्कस करते हैं कि मैं वो डेंटिस्ट के पास जाता था और वो मुझे कभी भी डराते नहीं थे और मुझे स्टिकर लगा के भेजते
So
थे.
the friend also wants to go and visit.
Wants to come at.
Wonderful. So this is a very good piece of advice. All the new doctors who have just finished their graduation, who are just about to start their practice, what they have to do is first they have to change their mindset towards pediatric dental practice. It's not something which can be avoided or should be avoided.
And you cannot afford to avoid something like that in today's world.
Absolutely, absolutely. So nice to listen to all this wonderful advice from your side, doctor. It was really wonderful talking to you, tapping into your vast pool of experience and bringing it out to the fore for every new pass out graduate or practitioner. So if you all have any more queries or doubts or something which you want to be clarified, you can always ask us, and we'll see to it that the query reaches the right person, Dr. Ganesh, for
I'll be more than happy to
dentistry.
answer those questions.
It was really, really wonderful talking to you.
Thank you so
Pleasure
much.
is all mine, doctor.
Thank you, doctor. Thank you, Keval.